Kenny, nurses are at breaking point in the state.
Danica, hi. In order to do this story, I've been speaking extensively with representatives for the Nurses and Midwives Association, particularly from Western and Far Western New South Wales, who tell me that there is a crisis and it's getting worse because nurses are leaving these regional areas in droves. A lot of the times in these hospitals and smaller hospitals in the regions, there's only 2 nurses on shifts and they're working in isolation behind closed doors, which is a safety issue for them. They're pulling double shifts. There's no doctor on shift either, and so they're having to deal with issues that doctors would usually have to deal with, and they're not trained or don't have the backup or facilities to do it. A warning though for our viewers, this story contains images of Indigenous people who have died. A family on their way to the local swimming pool in Wellington in the central west of New South Wales are mowed down by an unlicensed driver. The mother woke from a coma to learn her 2 younger sons had been killed. Wellington's local GP, Dr Ian Spencer, treated the family immediately after the alleged hit and run.
With the terrible accident of last week, I was actually rung by 000 to go to the hospital and help out. But, I mean, had there not been a doctor there and had I not been available to go, then it would have been just an absolute chaotic catastrophe, really.
It's lucky he was there.
We've been having a shortage of the doctors that come and run the emergency service, to the point where there have been some days, sometimes 4 or 5 days in a row, where there actually hasn't been a doctor in attendance at the emergency department.
There have been hundreds of submissions to a parliamentary inquiry that closed today. It will look into health outcomes across regional and rural New South Wales, including staff and doctor shortages. Nationals leader John Barilaro admits there are problems in regional health, but attracting doctors to rural areas is a complex issue.
But of course, any inquiry will highlight the negatives. We should accept that. I hear it on the ground. I was just in the Central West the other day at Parks Hospital, a new hospital that was built by this government, is struggling to get the staff that run its maternity ward, and it has 2 fantastic theatres and it doesn't have any surgeries there. So the reality is that there is an issue that we need to resolve.
New South Wales Labor has been calling for the inquiry since October 2019 and says the doctor shortage problem is because New South Wales Health has been cutting costs in the regions.
The fears are in a lot of these communities that there's cost cutting going on in a service that's already stripped to the bone. So when we see a doctor not having his contract renewed at Golgong Hospital, and then a poor woman turning up to that hospital expecting care, and she tragically lost her life. And subsequently that doctor has now been put back on at that hospital.
There's been a large uptake of telehealth services during the pandemic that the New South Wales Health Minister says has been a benefit to the regions.
The opportunities that have grown out of telehealth and virtual health are enormous, because what it means is that somebody who is in a remote small town where there are no GPs, there are no other doctors, can actually have world-class specialists giving them the advice and service that they need.
But according to Kate Washington, this will not ease the burden on country nurses.
Because there's a lack of doctors in hospitals, what we're seeing is nurses being put under immense pressure and trying to do the best they can with the resources that they have. But we are now facing a really difficult scenario, and it's heading towards a crisis.
You know, we've got a great story to tell about the hospital upgrades and the investments in new hospitals in regional rural New South Wales. And in the last budget, again, another $950 million going into hospitals just in regional rural New South Wales. But that's only part of the puzzle. The other part is actually about delivering the service. And we've struggled with GPs and specialists in parts of regional rural New South Wales, and that will be highlighted. But that's not an issue that we can fix on our own. That it will involve the federal government.
Dr Ian Spencer is worried for his town of Wellington once he retires.
I can look back on 42 years and say that all of the changes that have been tried have basically failed. And so the system as it stands has failed country people.
The hearings of the inquiry will commence later this year. Kenny Heatley, Sky News.